this is Dr. Sitesh Roy, your super specialist in immunology, allergy and asthma, coming to you with this special video on the mental effects of COVID-19. We have all heard enough about the fear, the anxiety, the stress that the whole world has been facing with millions of cases of COVID-19 positivity detected around the globe, almost 800,000 people dead, and still cases continuing to grow and rise every day in different parts of the world. We have also known a second fact about COVID-19 as this disease, the SARS-CoV-2 virus, has been amongst us, is that the virus itself induces certain mental health effects. These health effects have included irritability, they've included mood swings, headaches, fatigue, and then eventually leading to anxiety and depression. And it has always been a question in people's minds, is this an effect of the virus or is this an effect of the stress and the fear associated with the virus in people's minds? As further research has been done, some very interesting facts have come to the fore, where we realize that this virus, because it takes access through the nose, and as it goes through the nose, loss of smell is one of the first symptoms that is seen in up to 30% people, sometimes associated with loss of taste, because they go hand in hand. And the reason why this happens is it is believed that the virus, when it reaches the olfactory plate, which is a very thin plate of bone separating the olfactory bulb with the first part of the brain, the frontal area of the brain. In that area, it is believed when the virus gets access to the brain, it can actually influence many different things that happen from there on, because the olfactory bulb of the brain is connected to something called the fronto-occipital cortex of the brain. It's also connected to the amygdala and the hippocampus. And interestingly, these different areas of the brain with the dopamine and the serotonin neurotransmitters that they carry for different functions are associated with our mood, with our learning, with our behavior, and with our emotions. So it becomes abundantly clear that a virus that can gain access through the nose, affect the olfactory bulb, can certainly affect areas inside the brain. When you combine this with the fact that living with stay-at-home orders or in lockdown, living in isolation or with self-quarantine, living with work from home orders, there are a lot of people who also face the mental effects of this virus indirectly without catching the virus itself. And in those experiencing again isolation, anxiety, depression is not uncommon. There have been increases in even suicide death rates in several parts of the world that has been noticed during these times, which may not have otherwise been there. So when we look at all these mental effects, whether they are during the infection because the virus gained access to the body, or when it is without the infection but due to the surroundings around us, obviously the financial pressures and insecurities by themselves being a big issue for the whole world, we can understand that there has to be certain things that we can do in order to keep our mind and our spirit at its best. And in these, there are certainly certain things that can help us. One of the first things that we talk about is exercise. Even if exercise is done at home, because it does release a variety of hormones, including the release of the feel-good dopamine hormone in the brain, it can give us mood elevation and give us confidence and hope. And hence, exercise in any form or fashion, whether it is actually through weight training, through endurance, through aerobics, through yoga, through any other form that a person might do is invaluable for helping our mental health stay where it should be in a positive outlook and manner. The second thing that's very important is meditation. And amongst meditation, while there are many techniques known and many techniques that can be followed, one that comes to mind is mindfulness meditation, which helps us come into the present moment and connect with the here and the now, and relaxation techniques, which give you mind-body relaxation techniques. And so with the use of both of these methods, there have been studies that have shown that it can lead to mood elevation, it can lead to reduction of anxiety, reduction of depression, and through all of that, because our mind and our body, our mind and our immune system are very closely connected, we can also boost our immunity and enhance our ability to face the situation, whether we are facing an infection or just being safe and protecting ourselves from getting infected. Besides this, clearly eating a healthy, fresh diet, getting sunlight when and where possible, getting good sleep, at least 6 to 8 hours of sleep continuously, and along with it, making sure that we get fresh air when possible. All of these things can also help keep our body and mind in a positive state. Another very important thing that we should all be doing, and that is remembering that we have to physically distance, not socially distance ourselves. So talking to friends, family, colleagues, being able to laugh, smile, share things in our life is also so very important to keep our mental health and hence our immunity at its best. Watching comedy shows, watching funny things online, and laughing and smiling through the day can also keep us very healthy. So with that, friends, stay positive, stay hopeful. Remember that this too shall pass. Be happy, be immune. God bless us all. Till next time, take care.